Good morning. My name is Simin Khedivi and I'm the Executive Director of Alliance Health Clinic. Our clinic's mission is to provide low-cost or no-cost primary care, mental and behavioral and dental care for the low-income or no-income members of the community, including refugees, asylees, immigrants, single mothers, children, uninsured and underinsured. At this point, I would like to turn it over to our clinical psychologist, Dr. Russell Dennell. Good morning, Russell. Thank you for being here. Would you please briefly tell us about your new program?
Good morning. Certainly. So our medical and mental health program here focuses on the health and well-being of refugees and their families. We see thousands of patients every year. As a leader of the mental health program here, I focus on refugees who have been traumatized by civil war. Through the therapeutic services I provide, we're alleviating the suffering of parents of hundreds of refugee children. Refugee parents struggle with the daunting task of surviving on very limited financial help as they attempt to meet the demands of learning English quickly and for getting jobs. Very often these parents are suffering from severe depression and anxiety, and I work to reduce that suffering and to help them understand the significant developmental impact that the behavioral expression of that suffering can have for their kids. I work with parents to gain the skills to support their children in a school system where the U.S. and refugee cultural values can sometimes be really different. I help them understand peer culture and how to shelter their children without severely limiting their children's involvement in school activities, which are part of being a normal child in the U.S. Our refugee children learn English very quickly and become the language and cultural ambassadors for their parents. Parents then sometimes struggle to negotiate this reversal of authority and expertise when they are called on to discipline their children. So we measure the impact by setting clearly documented clinical goals and monitor progress as we go. I use the RHS-15 and the PHQ-9, which have been validated for use by refugees. For this program, outcome measures might include participant experience, parent understanding of the developmental challenges that children face, increased confidence providing appropriate parental guidance and discipline, the ability to understand when a child is struggling and needs help, and increase confidence themselves to identify and reach out to support systems for their children.
Thank you, Russell. We're so excited to have this program at Alliance Health Clinic. Thank you.
Thank you.